Imagine this. It is early morning. You're pouring your coffee, and your dog trots over, tail wagging, ready for the day. Then you crouch down to say good morning, and you freeze. Something about their eyes looks different. A little cloudy, a little red, a little too watery. And a small, quiet worry creeps in. What is that? What is my dog's body trying to tell me right now? I know exactly how unsettling that moment is. Start Googling at midnight. You scroll through 40 photos of other people's dogs trying to match the redness to yours. And then comes the $80 emergency vet. Visit just to be told keep an eye on it, no pun intended. And what's worse, a week later it happens again and you still don't know what you're actually looking at. But what if I told you your dog's eyes are one of the most honest, most overlooked health dashboards on their entire body? What if I told you that the color of the discharge, the size of the pupil, even how much of the white is showing, is your dog quietly narrating exactly what's going on inside them? Today I'm going to show you exactly how to read those signals, what they really mean, and which simple, gentle, vet-safe home care steps you can use the moment you spot something off. Hi everyone, I'm Dr. Marcus, your neighborhood veterinarian, and welcome back to the channel. If you're new here, I dedicate this entire channel to helping you become the best pet parent you can possibly be. Using simple, vet-approved home care and a whole lot of straight talk, before we dive in, drop the guilt. You are not a bad pet parent because you didn't notice a small change sooner, or because you're not sure what a symptom means. In fact, the very fact that you're watching this video right now, pausing your day to learn this, proves you care more than most. I actually posted a video on decoding your dog's body language, which I'll link at the end.
Oh.
And this one pairs perfectly with it. So today, we are doing a complete masterclass. Grab a notebook, because I am about to give you 6 things your dog's eyes are telling you right now. What the science behind each one actually is, and exactly what to do about it. Let's get into it. Chapter 1. I'm calling this one the calling card, and it might be the most useful thing you learn all year. It's not just goopy eyes. It's your dog's immune system leaving behind a biochemical calling card. And the color of that discharge is basically a coded message. Here's the problem. Almost every dog owner sees eye gunk and either panics or ignores it completely. When the color alone tells you almost everything, here's the science. Kept simple. Clear, watery discharge usually means irritation, pollen, dust, a stray eyelash, mild allergies. White or slightly gray mucus, especially first thing in the morning, is often just normal overnight buildup. But yellow or green discharge signals a bacterial component, meaning the body is actively fighting something, and that changes the urgency completely. For the clear, watery kind, here's your remedy. Brew a cup of plain black tea. Let it cool completely in the fridge for about 20 minutes. Then soak a clean, soft cotton pad in it and gently wipe from the inner corner of the eye outward. Once in the morning and once at night. The tannic acid in black tea is a mild natural astringent that helps calm irritation and reduce that watery tear staining you see on light-coated dogs. Here's a quick warning. This compress goes on the fur around the eye only, wiping outward, never directly into the eyeball, and never anywhere near an actual scratch or injury. If you ever see yellow or green discharge, skip the home remedy entirely and call your vet, because that needs an actual diagnosis, sometimes antibiotics. Chapter 2, and stick with me here because this one is important. This is the redness tell. It's not just bloodshot eyes. It's inflamed blood vessels dilating in response to pain, allergy, or pressure inside the eye itself. and figuring out which one matters enormously. Mild redness with some squinting after a walk in a dusty field is usually just irritation. But sudden, intense redness, especially in only one eye, paired with squinting and pawing at the face, can be a sign of something like a corneal scratch or even elevated eye pressure, both of which are genuinely painful. For the mild everyday redness, here is a gentle remedy. Steep a chamomile tea bag in warm water for 3 minutes. Let it cool until it's just barely warm to the touch. Wring it out. And hold it gently against the closed eyelid for about 60 seconds. Chamomile contains a compound called apigenin, which has a calming, mild, anti-inflammatory effect on irritated tissue. But here's a quick warning, and I need you to really hear this one. If the redness is sudden, only in one eye, or your dog is pawing at their face or refusing to open the eye, that is not a chamomile situation. That is a same-day vet visit, because pain that intense can threaten your dog's vision within hours, not days. Is my personal favorite because almost nobody talks about this one. This is the cloudy window. It's not just old dog eyes. It's actual protein changes happening inside the lens of the eye. And there are two very different things that can cause that bluish-gray haze. The first is called nuclear sclerosis, a completely normal aging change that shows up in most dogs over 7 or 8, where the lens gets a slight blue-gray haziness, but your dog can still see just fine. The second is a true cataract, where the lens becomes opaque and vision genuinely starts to fade. Now, here's what's truly fascinating. You can often tell them apart just by watching how your dog moves. A dog with normal aging haze navigates the house exactly the same as always. A dog developing a cataract starts hesitating at stairs, misjudging the distance to their water bowl, or startling more easily when approached from the side. There isn't a home remedy for either of these, because both live inside the lens, completely out of reach of anything topical. What you can do is a simple daily habit. Once a week, sit facing your dog in good light and just compare both eyes for symmetry. Haze and how quickly the pupils shrink when you turn on a light. Here's your warning. Never assume cloudiness is just old age without a vet confirming it. Because true cataracts left unaddressed can lead to secondary glaucoma, which is a genuine emergency. Chapter 4. This is the third eyelid tell. And let me guess. You're probably thinking your dog doesn't even have a third eyelid. Almost every dog does. It's not extra skin. It's a protective membrane sliding up from the inner corner of the eye. And it's a surprisingly sensitive whole body indicator. When your dog is deeply relaxed or sleepy, you might catch a little sliver of it, and that's completely normal. But if that third eyelid is visibly covering part of the eye while your dog is awake and alert, that can point to dehydration and upset stomach, pain somewhere else in the body, or even mild sedation, like lethargy from illness. The gentle at-home check here: press 2 fingers lightly on your dog's gums. If they turn white and take longer than 2 seconds to return to pink, combined with a raised third eyelid, that's often a hydration flag. The remedy is straightforward. Offer fresh, cool water, and if they're reluctant to drink, try adding a small splash of low-sodium chicken broth to encourage them. But here's your warning. A persistently raised third eyelid for more than a day, especially paired with lethargy or not eating, is your dog's body waving a flag that something systemic is going on, and that calls for a vet visit, not a broth bowl. Chapter 5. This is the pupil tell, and I promise you, Once you learn this, you'll never look at your dog's eyes the same way again. It's not just big, cute puppy dog eyes. Pupil size is directly controlled by the nervous system, which means it's one of the fastest, most honest windows into pain, stress, or even neurological issues. In a calm, well-lit room, your dog's pupils should be small to medium and roughly equal in size. Wide, dilated pupils in normal lighting can signal pain, fear, or high stress. And here's the one that surprises most owners. Pupils that are two different sizes, even slightly, are never something to brush off. There's no home remedy for this one because it's a nervous system signal, not a surface irritation. What you can do is a simple 10-second daily check. In normal room light, glance at both pupils and confirm they match in size and shrink evenly. When you briefly shine a phone flashlight past, not directly into each eye. Here's the warning, and it's a big one. Uneven pupil size, sometimes called anisocoria, can point to anything from a minor issue to something neurological. And it always warrants a same-day call to your vet, especially if it appears suddenly. Chapter 6. And this is our foundation chapter, the one that supports everything else. This is the blink rate tell. It's not just dry eyes or sleepy eyes. Blink frequency and quality reflect tear film health. And dogs with chronically low tear production are more prone to irritation, infection, and long-term discomfort. Some breeds, especially those with shorter, flatter faces, are naturally more prone to this. A simple, gentle daily habit protects against most of what we've covered today. Once a day, use a clean, damp, warm cloth to softly wipe away any crust or debris from the inner corners of the eyes, always wiping outward, never inward, toward the nose. This alone reduces buildup that can otherwise turn into irritation or infection. Here's your warning. Never use cotton balls, since the loose fibers can stick to the eye surface. Never use any product containing alcohol, tea tree oil, or essential oils anywhere near your dog's eyes, since these can cause serious chemical irritation. Now, please listen closely because this is a massive veterinary warning, and I want it to be the one thing you remember above everything else in this video. Every single remedy I gave you today is for mild, everyday irritation only, the equivalent of your eyes feeling a little tired or dusty. None of these are treatments for pain, injury, or sudden changes. If you ever see your dog squinting and keeping one eye closed, pawing repeatedly at their face, bleeding from the eye, a visible bump or growth on the eyeball itself, or any sudden change in vision like bumping into furniture, stop everything and get to a vet the same day. Eye tissue is incredibly delicate, and problems that seem small in the morning can threaten permanent vision by nightfall. No T-compress, no gentle wipe is ever a substitute for that call. Here is the golden rule. You do not need to use all of these at once. Daily, do the simple warm cloth wipe from Chapter 6 to keep the eye area clean. 2 to 3 times a week, if your dog runs through fields or has watery eyes after walks, use the cooled black tea compress from Chapter 1. As needed, if you notice mild redness after a long day outside, bring out the chamomile compress from Chapter 2. The whole daily process should take you no more than 2 minutes. Watching for changes in your dog's eyes is one of the quietest, most easily missed parts of being a pet parent. But by choosing to educate yourself, by choosing to take just 2 minutes out of your day to really look at your dog, you are proving how much you truly love them. That makes you an incredible pet parent. If this video gave you a little more confidence today, please hit that like button It helps more pet parents find this information when they need it most. Subscribe and hit the bell so you never miss our weekly deep dives. Please leave a comment telling me, has your dog ever had a sudden eye change that scared you, and what did you end up doing about it? I read every single one. Give your sweet, beautiful dog a gentle scratch behind the ears for Dr. Marcus tonight. I'll see you in the next one.